Hello, everyone, and welcome to the Determinants of Her Health podcast, where we analyze the systems that affect women's health and how we can shape them. Today, I have with me Jaye Wilson. Jaye is a maternal health advocate, nurse, and founder dedicated to advancing equitable perinatal care through education, advocacy, and community-centered support. Through Melinated Moms and her coaching, training, and outreach initiatives, she empowers families, healthcare professionals, and organizations to improve outcomes across the maternal health spectrum. Her work bridges clinical expertise, lived experience, and faith-centered leadership to create transformative support for mothers and communities. Jaye, thank you so much for joining me today.
Thank you for having me, Allie. I'm so excited to have
I
a good
am
conversation today.
Yeah, it's going to be a good one. Today we are talking about Black maternal health. And this to me is a topic that is so important. I think once you kind of enter the maternal health, like pregnancy space, it becomes really evident that this is an area of huge need and huge opportunity too.
Sure.
Yeah.
Absolutely. I think when we think about perinatal health, we often forget that it doesn't start at pregnancy. It actually starts in preconception. So a lot of the conversations that I've had with expecting moms, it actually starts with what happened before you were pregnant.
Mm,
Did you have conversations with your family, with your partner? Are you aware of how your body was, how your body was doing?
yeah.
How were you taking care of yourself prior to finding out that you were expecting a little one? And I really like to put that into the forefront because we have to remember the things that we do prior to becoming pregnant actually can impact our pregnancies and thereafter.
Mm,
So, having conversations with young people, um, I like to talk to like high school kids and their parents. One of our really great partners is Planned Parenthood. So, we've done a lot of work with them. We actually created a curriculum called My Black Health is Beautiful that's geared
cool.
towards high school and young adults to have these open conversations and know more about their reproductive health choices, what body autonomy looks like, and also how to have intergenerational conversations as well.
Yeah.
Um, I remember when I had my kids are so much older now, but the first time I became pregnant, the first person I went to was my grandmother. She
Oh,
raised me. So I asked her, like, well, Nana, how did you get through your pregnancies? And she was like, girl, I just did what the doctor told me, and it didn't hit me as hard as it does now to
mm,
know that she was never really allowed to participate in her care. It was just, this is what
mm,
happened to me, and I just had to go along with it, right?
yeah.
So now we have the great opportunity of not just understanding what's happening, but actually be an integrated partner in our care, which ultimately gives us better outcomes.
Yeah. I love that it really fits in within the social determinants of health framework, where
Yeah,
there are so many things that can affect health outcomes and it can affect your pregnancy that you may
sure.
not be aware of. That, before I learned about the social determinants of health, I would have never thought about how those things really impacted my pregnancy.
Yeah.
And yeah, to your point about advocacy and being like a partner and really being involved in advocating for yourself in pregnancy, that was something that I unfortunately had to learn the hard way with my first child being stillborn. Like, really
Mm.
realizing, like, oh, in my subsequent pregnancies, kind of demanding more and asking more questions and not just trying to be a good patient and, listen and follow all the rules and stuff.
Yeah.
But really being active and involved was when I realized, oh, wait, I'm allowed to do this. Yeah.
Yeah. Yeah. Because it's your care, right? And
Yeah.
it's the care of your baby. So if no one is going to advocate for either of you, you will,
Yeah.
right? I think it's also a good time to also think about our village that is a part of our care, inside and out, right? Your husband, your partner, your aunties, uncles, sisters, brothers, mom, dad, right? Whoever is a part of your family unit, this baby is now a part of their lives too, right? So the investment in your health starts and continues through all of those people, right? So having those conversations with them, having them learn more about how things have evolved, I don't like to say they always change because
Mm.
birth is still birth, right? But there has been a huge evolution as to how we give birth, and how we also, again, can participate in our care. And same thing for our partners. You know, we want our husbands to know, like, you are a part of this advocacy team too. If
Yeah.
for some reason I can't speak, or if things are not going the way that we talked about, you have a say so in this too, you know? I see a lot of men who are starting to be more vocal about the maternal health issues and maternal mortality, particularly. And
Mm.
a lot of them are coming in from that mortality side. But
Mm.
there are more men, more Black fathers as well, who are like, I want to actually talk about life. I want to talk about how do we be preventative instead of reactionary, and then bringing more men and fathers into these conversations. So this is a holistic experience, but you're right. It does directly connect to the health, the determinants of health, and what disparities can or may look like when we don't have the right support behind us.
Yeah. So
Mhm.
let's dive into that. Can you like paint us a picture of what Black maternal health care looks like in the US and what that looks like, maybe where some of the disparities lie and what you see through your work?
Absolutely. So the first time that I was introduced to the Black maternal health crisis as a topic of discussion was actually in 2018. I had the opportunity to work with a doula agency, and they were like, you know, you're really good at like cultivating these conversations with moms. So, you know, can you help us with diving into how doulas can be a part of their care to improve their outcomes?
Mm.
So they suggested I watched a few different documentaries, and the one that we landed on was called Death by Delivery, and very impactful. It's actually still available on YouTube. But that was the first time that I actually saw it like directly in my face, right? So
Mm.
I'm hearing all of these statistics. Black women are dying 4 to 5 times the rate of white women, and depending on what cities you live in, or depending on your health insurance, or systemic racism. And as a Black woman myself, I've always known racism is a thing. That's not new to me, but I had no idea how impactful it was, or how significant it came across in our healthcare lens, and even in just diagnostic care. So watching that documentary opened my eyes, as a owner of an organization, but it completely blew my mind as a nurse, because I've been a nurse now for 20 years, but professionally as a nurse, I know I've always went into care with my patients with the utmost respect, and I always learned from the environments I worked in, but it made me like second guess. Have I ever been a person that was contributing to inequitable outcomes for patients? Have I always created a place for them to feel comfortable and safe? Have I always created an opportunity for them to advocate for what it is that they need, instead of telling them, well, this is what you're going to get, and those things were pointed out in that documentary. So fast forward, once we settled on that documentary, we held this event called Childbirthing in Communities of Color. We had a panel discussion, and we showed clips of the movie.
Mm.
And we had maybe about 35, 40 moms that came from all over. This was in New Jersey. And we had this really robust conversation. And I always say, because it's funny now, you never know, you don't know what you don't know. But at the time, I wasn't I wasn't serious, I guess, about what melanated moms could turn into.
Mm.
I wish that I could have recorded that conversation. When I tell you, it was amazing. We were supposed to be there for 90 minutes. We ended up being there for 4 hours.
Oh, wow.
So it was so much like rich dialogue, and the women just created such a safe space for everybody there. There were women who were expecting, there were women who had children, there were women who are more moms of loss, there were women who never had kids, but everyone felt like they belonged in this conversation.
Mm.
And at that point, it's shifted. This work that I'm doing with creating this organization, initially it was around social wellness. So helping moms not feel lonely, helping them find mommy sister friends, pairing people with kids who are around the same age. That was my biggest focus. But once I learned about this crisis and I learned that I also have been a part of all of these same things that we're seeing in this movie, I just fortunately get to tell the story. I'm like, this is a bigger responsibility. This is a completely different avenue that I might not have initially wanted to be a part of, but I absolutely have responsibility to be a part of, you know?
Yeah.
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 So,
I saw the Aftershock documentary
mhm,
when I think Push was like a little bit involved with it. Push was the organization that I used to work at.
mhm,
And I, yeah, I came away from that feeling sort of a sense of responsibility in a way too. Just like, I mean, it was mind blowing to me to
yeah.
see just how much of a disparity there was, and just
Mhm,
how much of a crisis that this is.
yeah.
And I was just like, how do people not know that this is happening? Like, how was I involved in this world and didn't know that Black moms are dying at the rate that they are? And I think that when you like kind of get into the bubble of the perinatal world and like you become aware, but I still don't know if like the general public is aware of the statistics. And Black Maternal Health Week and these awareness initiatives are so important because everybody needs to know this.
Right.
Like it's like absolutely mind blowing to me still that Black moms are dying at the rate that they are.
Yeah. I think the biggest statistic that still shocks me is 80% of the deaths that are associated with maternal mortality are preventable, you
Yeah.
know. So to know like, you know, there are 80 people out of 100 that could still be here if someone had listened to them, if someone had
Mm.
took their symptoms seriously, if someone had intervened instead of threw their hands in the air or
Yeah.
made them wait or delayed care, you know? Even like in the movie Aftershock, Bruce talked about his partner and her, I think she developed HELP syndrome,
Yeah.
and they were actively in care and asking the right questions. What do I
Yeah.
do for this? How do we prepare for this? Are there any medications we can take? Are there any other interventions we can be prepared with? And these questions were falling on deaf ears.
Yeah.
So when she passed away from something that they actually knew was coming, it was like, how else was he supposed to support her? How else was he supposed to be the advocate that she needed? And even for herself, how was she supposed to advocate for herself if the people who are a part of her care don't find her life significant enough to actually create an intervention that saved her life, you
Yeah.
know? So it's so heartbreaking to know that there's people that should absolutely be here. There are children who should be grown up with their moms, you
Mm.
know? There's another amazing woman that's doing work with grandparents, Wanda Irving. Her daughter, Dr. Shalon Irving, was a PhD. She was in the military. Her work was actually rooted in maternal health disparities, and she died of the same thing she actually wrote a textbook about. Like how much more of, a significant example do we need to see in order for people to take this seriously?
Yeah.
You know, um, it's so hard because no matter how long we do this work, one death is still always too much.
Yeah.
It hits you like it was just yesterday again, and to live through these things or to watch people have to go on with their lives and still just try to figure out like, how do I navigate this? How do I do this? This was this is much different than I went into labor early, or my water broke when I was at the carnival. Like, this is it's completely life changing for everybody, and including that baby.
Yeah.
So
Yeah.
it's the hardest piece of work I think I've ever had the opportunity to participate in, but
Mm.
it's also the most rewarding. I wake up every day and I'm like, I love what I do, but I hate that this is something that we have to do because it shouldn't even be a thing. This should
No.
not be something that we have to advocate for, but we're gonna still do it, you know?
Yeah, 100%. One of the moms, I don't know if it was the same mom who developed HELP syndrome. I don't think it was, but one of the moms had thrombocytopenia in pregnancy, which is when your
Hmm.
body eats all your platelets. And
Hmm.
her story, Amber Rose Isaac, her story
Yeah.
especially stood out to me because I had that in all three of my pregnancies. And
Mm.
the way I was treated compared to the way she was treated was such like a stark contrast that it made me feel like watching it, I felt like physically ill because I
Mm.
remembered I had my blood cell count taken at 20 weeks and immediately my doctor emailed me and said your levels are just slightly low, so we're going to
Mm.
monitor this. And then in my first pregnancy, Hank, died before it ended up getting bad. But then in both subsequent pregnancies, I had to be put on a steroid to monitor it so that I
Mm.
could not have complications in birth. And I mean, I had at one point blood tests twice a week. I mean,
Mm.
the level of care that I was given, I was like, I truly felt that like I was in the doctor's care, whereas like Amber Rose Isaac was like at the mercy. Like, and
Right.
yeah, it still like haunts me to think about just how well I was cared for and then how blatantly ignored her levels were, where you can see like they looked back on her chart and said you can see the platelet count was so horribly low,
Mhm.
and they did nothing. No follow up, no attention to it whatsoever. It's just like absolutely heart wrenching. I think another story that stands out is remembering Serena Williams,
Mhm.
who said a woman who's a household name who
Right.
still experienced racism in her birth and in her care. And then I remember there was the study that was done that kind of goes against what it doesn't go against the social determinants of health, but it just exposes that even black women with graduate degrees are still have worse outcomes than poor white women.
Mhm.
And it just goes to show like the issue here is not it, access or education. The issue is racism. Like that is
Absolutely.
truly the determining factor here. Um,
Right.
so yeah, I guess with that we can kind of zoom out now. We know where the problem is. Like black moms are dying at 4 to 5 times the rate of white women, and it's echoed in other numbers too. Like the stillbirth rate for black moms is 3 times higher. I even heard I'm going to be interviewing someone who explained that medications that are prescribed for issues with bladder control are typically medications that are known cancer causing medications. Those are prescribed to black women at higher rates. Like it echoes in all different forms of women's health and in general medicine. So let's zoom out and say, like, what are the systems level sort of determinants that are affecting this?
Yeah, great question. So, I'll set it up by actually addressing what you just said a little bit earlier, which is your lived experience, right? So when we think about how we were treated, that is our truth. That is what we recall, and that's also what shapes the way that we gravitate towards or move away from these same systems, right? So, not taking anything away from your experience,
Yep.
but if your doctor poured so much care into you, you couldn't fathom that same doctor seeing a woman that looks like me not doing the same type of care,
Yeah.
right? So when we're having this conversation and it's such a stark contrast, I can see you being like, that just doesn't make sense. Dr. Smith was amazing with me, right?
Mm.
So when we're having conversations with people who don't have these experiences, it's harder and harder for them to grasp that someone else could have this ridiculous experience unless there's something that was a justification or there was some type of defensiveness or combative behavior, because when we put it in that context, then it's justified,
Mm.
right? So the second part of that is when we say directly this is a product of racism, a lot of people typically hear, you're calling me a racist,
Mm.
right? And it's not about calling you a racist or any of that stuff. It's about understanding the differences between how race impacts a person's decision. And this is on both sides, from the medical provider to the patient. Right? We actually, with Melinated Moms, we do a lot of perinatal classes, and we have this one class called the Eight Dimensions of Health and Wellness. And one of the concepts in that class is actually discussing how implicit bias is a part of how the doctor or your medical provider determines diagnostic care, but implicit perception is how a patient decides how they're going to actually be involved in the care, right? So, from a Black woman's point of view, and I've had a conversation with plenty, them being forthcoming about smoking marijuana or having a history with using drugs or even having a history of stillbirth or loss.
Mm.
Sometimes those words are not used as a part of creating a better plan for prevention of loss or, extending the pregnancy. Those things can be used as mechanisms to police these women,
Mm-hmm.
you know? So, what was it? This past Mother's Day, every Mother's Day, there's actually a march in DC that's called the Black Mothers March. And they particularly look at how these very direct lines between Black mom participation in patient care and different medical providers have actually increased family surveillance, child protection, excuse me, and people losing their children over having informed consent and making a decision that the doctor didn't agree with, or going to seek care and saying, this actually doesn't work with my family. We all have the right to choose. We have the right to refuse care. We have the right to make decisions and be informed about the risks and benefits. But for a lot of Black and brown women, our choices may be there, but we have to be very, very vigilant with which choice we actually make, right?
Mm.
So you'll have a lot of like um remorse around what you wish you could have said, but the like that extra thought in the back of your head, like if I tell them this, what other dominoes are going to fall down,
Yeah.
so sometimes they make decisions based on that fear as opposed to actually being seen as the same patient that you see yourself as, right? So when we zoom out and look at this as a systemic problem, we can look at standard practice guidelines or universal guidelines. All of these things are created not based on our race, ethnicity, culture, or language, or these other identifying factors of who we are as people. It's based on one or maybe two archetypes of a patient. And if you don't fit in this box, then you are now the outsider. You are now being looked at as if you are trying to be adversarial, and you have a higher likelihood of clinical harm or exposure to some type of trauma in your birth or in your care experience. I'll give a really good example. I When I was having my children, I'm a four-time survivor of preeclampsia. I'm a stillbirth mom, and my first pregnancy was actually a coerced abortion, right?
Mm.
So went to the doctor. They told me I had preeclampsia. I was 19, had no idea what preeclampsia was. I'm getting all upset thinking it's a STD. They're like, you
Yeah.
gotta get rid of this baby. You got Even just the fact of not knowing what this word means and the doctor not wanting to explain it to me, but just pushing me to terminate the pregnancy. That's taken away my ability to choose the option that was best for me,
Yeah.
right? So that first pregnancy, I didn't feel like I had a choice. I had to go with what he said because the only thing he told me was if you keep going with this pregnancy, you're gonna die. Didn't give me any other explanation. You have preeclampsia, you're gonna die, the baby's gonna kill you. So I terminated the pregnancy. My second pregnancy, I got preeclampsia again. My weight was up and down. I had terrible hyperemesis. I was probably about 95 to 100 pounds at 6 months pregnant. I was a rail. And I actually ended up starting my loss on the city train.
Mm.
So if you could imagine being on a train line as the train is moving, you stand up to get off the train and you feel a big gush of blood, and no one said nothing. No one moved out the way. No one asked if I was okay. and the all of these pieces still stick with me, you know? And even with that whole thing, I left the train, went to the police station in the train station, and the police were looking at me as if I just robbed somebody. I'm like, can you help me? I'm bleeding. I'm 6 months pregnant. They're like, what's your problem? Why are you over here? Why are you talking to me like this? I'm
Yeah.
asking for help, you know? So when we think about how all of these systems continuously shell harm towards women who look like me, it makes sense that we're very distrustful, or we don't want to always participate because we literally don't know who we're going to get or how they're going to decide if our lives mean something or not, you
Yeah.
know? So it's a horrible reality to have to live in, but it's also I've also been able to learn how to reframe this as a part of my purpose. So
Mm.
these things that I went through, I don't ever want anyone to ever have to face. But if they do, I want to also be able to provide them with support. I want to provide them with visibility, and I want to help them know that I'm a part of the action steps that they need to take to learn how to heal and to grow from there. You know,
Yeah.
we can't go back.
Yeah.
We can't do things based on information that we didn't have. But what we can do is be preventative. We can be prepared. We can look at organizations like ours that are really taking a step forward instead of 10 steps back.
Yeah. I kind of wanted to end on this, but I think this is actually a good time to bring this up because what I'm hearing is it is so important for everyone, and especially for white people,
Mhm.
to listen to and trust lived experience.
Absolutely.
Because, and to your point earlier when you said, like, oh, I had Dr. Smith and Dr. Smith would never. It's like,
Hmm.
Dr. Smith may never to me, but I don't
Right.
know the lived experience of living in a black body. And so
Hmm.
for us to listen to that lived experience and trust that that is the lived experience because that, you know, just because it hasn't happened to me or just because I can't imagine it happening doesn't mean
Hmm.
it wouldn't happen to someone
Right.
else. I think if all of us had the humility to do that, we would be in a much better place.
Hmm.
And then also, it's just so frustrating because I'm taking these like public health classes. I really want I love looking at things from like a systems level perspective and seeing like, okay, what are the ways that help? And it's like, okay, smoking cessation in pregnancy, super important, really great like preventative tool. But if a patient doesn't feel that they can tell their provider that they're struggling with smoking cessation, then like that just completely closes the door on that preventative measure. And like
Right.
how many more preventative measures are being completely blocked just because these patients don't know the real risk of opening up to their provider and explaining that there's something that they're struggling with, or a family history, or anything, like just because,
Right.
like you said, it puts them immediately in that box. It's it's so it's so hard with issues like this because there's no one easy policy answer. There's so many like heart changes and like changes to like the way of thinking that have to happen. But like you said, it's so worthwhile for us
Oh,
to have this conversation and talk about the inequities and try to move forward in order to keep people safe and alive.
yeah. No, I agree. And I think to that point, also, you said one amazing word that people really need to hear more often, which is policy,
Mm-hmm.
right? So we can look at what policies impact our resources, our budgets, what our state and our federal government offers, what private entities offer or support. But the people with the lived experience, they are the least likely to be at those tables
Mm.
to talk about the impact of these policies, whether they're able to receive the care or not, right? So, one of the things with us, Melinated Moms is our for-profit arm. We do all of the work in maternal health equity for moms. It's a membership base. We also do educational classes, but we also have a nonprofit arm called Connecting Our Communities for New Jersey. And in that work, we teach parents how to be advocates. We teach them how to use their lived experience to talk to legislators and to understand the people to policy pipeline. So, how am I as a person impacted by these policies? How does it change the infrastructure of what's available to me, whether it's through health insurance, private pay, or a combination? What other factors may need to be considered in order for this policy to provide a resource that I can actually utilize, right? I mean, we're all out here in this new economy, and gas is almost $6 a gallon,
Yeah.
right? It doesn't care if you receive Medicaid. It doesn't care if you have private insurance. $6 is $6, right? So it's a lot of families that are struggling who may have never thought that they were struggling before until they had
Yeah.
to fill up their gas tank and it cost them $150, right? So we're seeing it on so many ends of how many people are like being so stretched thin, but they are not aware of the policies and how they have changed in order for these prices to go up and to shift the way that families have security or not, right?
Yeah.
There's so many programs that used to exist or that are being drastically defunded because of new policies or because of these huge revisions that are taking away the way that people are actually changing their health outcomes. I'll give you a really great example. One of my really good girlfriends is a senator in Tennessee. And I know you've been seeing on the news about how different states are starting to do redistricting.
Yeah.
And she's the senator for the city of Memphis. And they are completely redistricting her district. And it's taken away the voice of the black voters, the black people who live there, who need those resources. And they're being replaced with people who don't look like them, who don't come to their neighborhoods and are not invested in them. So how likely are they to, one, trust these systems, two, follow the policies that actually are going to benefit them because they don't see them,
Yeah.
and three, actually want to become more civically engaged? They're not going to want to, you know? So when we think about social determinants of health, when we think about health disparities, when we think about people and policies and resources, all of those things are shifted in such a drastic way. It's almost dehumanizing, right?
Mm.
For us to really think like, oh my God, we all live in the same country, but inequity is becoming more and more in the forefront. For women who look like me, we are waking up afraid every day because we don't know how much more of our rights are being taken away, right?
Yeah.
We don't know what places may exist today but might be gone tomorrow. Um, we also do some work with different organizations that support women who are living with HIV and
Mm.
who are still childbearing. One of my great colleagues, her name is Lynette Trawick. She does HIV advocacy as a HIV doula. And she talked about having conversations with your medical provider to talk about which HIV medications may impact fertility or conception.
Yeah.
um when she was married, her and her husband was negative and she was positive, but they wanted to have a baby. So they said, how do we do this in a safe way? How do we make sure that my medication doesn't interfere with the development as
Yeah.
well as my CD4 count? How do I make sure that my husband stays negative? All of these are responsible decisions, and all of the science is there. All of the ability to make sure that she has the support she needs is available. But there are still medical providers and systems that will just tell her, you ain't supposed to. You can't do
Mm.
this. You shouldn't have any more children. And those things are based upon old science and personal beliefs, as
Yeah.
opposed to the evolution of HIV being a disease that is now moving into almost chronic conditions for people. I'm not saying it's not devastating. It
Yeah.
absolutely is. But the HIV from the 80s is much different than 2026. you know?
Yeah.
So we need to know all of these things are areas that we need to advocate for. We need to hear from the people who are living in these experiences and also pay attention to how they're creating innovative measures to improve outcomes even before it's recognized in the bill or a policy. You know,
Yeah.
the community will always tell you what they need. We just have to listen.
Yeah. Can you speak to like what are some ways that even local policy would affect like health outcomes and specifically pregnancy? Because I know there's like, you know, it matters what these local policies are. You know,
Mhm.
if they're allowing, you know, say certain plants to be developed right next to a housing development, and there's certain pollutants and things, like what are some examples of that, and how it's so important that people be engaged civically, and also just how devastating it is when the right of civic engagement is suppressed and taken away.
Absolutely. And that's a really very great example. So I have two examples that's going to turn into one.
Okay.
So in my nursing experience, for probably like the last almost 10 years, I've been working in pediatric home care. So a lot of the patients I've seen, they were either born early or had a congenital effect, or sometimes there was an accident and it caused long-term health issues for this child. It's very interesting to see the response certain patients will have to like respiratory issues or cardiac problems based on where they live. So I remember having a young patient who's about 3 or 4 who lived in a very industrial area, and he would have these terrible, terrible coughing fits. And I will often have to just monitor his breathing. I was an overnight nurse, so overnight. And as I'm charting and I'm looking through like his records, I'm realizing during certain times of the day his oxygen levels were much better, but it usually was when he was at school or when he was away from home. But when he comes home, his oxygen levels were lower. He was having more difficulty with breathing, and then I noticed I was too. I'm like, I'm coughing way more when I'm coming over here to this patient's house, you know, and this relates to a good girlfriend of mine who's actually in the UK. Her name is Agnes. She runs an organization called Global Child Maternal Health, and she actually does a report on the exact same thing with air pollution and respiratory distress. It's called Black Child Clean Air. And every year she has a conference. But she specifically talked about in the UK, they don't call it redlining, but it's the exact same equivalent here. But how specific areas in the UK have a higher prevalence of Black and Brown people, but they also have an increase in respiratory issues, respiratory failure, preterm labor, postpartum complications, and even stillbirth. So
Hmm.
if we can see how these industrial air pollutants, same thing with water contamination. I'm originally from Buffalo, New York. I don't know if you remember years ago, the whole thing like with the Love Canal, and it was like this whole thing with water contamination and how it actually impacted a lot of pregnant and postpartum people. Same thing with like making formula. Newark had this issue a few years ago with lead in the water. Like all of these things really do impact communities, and more than 50% of the time, these things are happening in communities of color,
Yeah.
and they're long-standing issues because they're in communities of color. If these same issues were happening at the same rate in white communities, it wouldn't be an issue.
Mm-hmm.
So again, back to what we were talking about earlier, white people are like, that can't possibly be an issue. We don't have that problem. Yes, in your experience, you don't. But if you're coming to these neighborhoods where you see there's 3 power plants here that are pouring all this stuff into the air, or you turn on the water fountain or the water spout and the water does not run clear or it has a smell to it. These aren't things that you may be used to, but this might be something that is other people's daily lives,
Yeah.
right? It doesn't even mean that you have to be poor or you have to be uneducated.
Mm-hmm.
This just may be the area that you live in.
Yeah.
And people just learn to adapt to those things, or they're told, well, just boil the water, or just do this, or just do that, instead of actually looking at, is there any policies available that actually make this illegal? Is there any ways that we can talk to our legislators to create a larger level of change and more visibility for this thing? Um, Sorry, I'm going on a tangent.
No.
Um, last experience though. Um, Maybe about almost 10 years ago, there was a young lady in Michigan, they called her Little Miss Flint, who was advocating for clean water. And she had to be, I think, between 9 and 12 years old when she started her advocacy. It was just her standing on milk crates in a bullhorn, and she was saying how important it was for her to grow up with clean water. And her advocacy spread through social media. It ended up opening a bunch of eyes of celebrities and, big ticket people, but it really helped people to recognize that this is actually not a Flint, Michigan, just a Flint, Michigan problem.
Mm.
It blew the all the levees, probably bad words, but blew everybody's mind
Yeah.
when they realized, hey, me too. Hey, over here we're having the same
Mm.
problem. Hey, now we're actually checking our water levels. We're actually looking at the prevalence of children having cognitive issues or higher lead rates when they go to the pediatrician. Now we have something to correlate it to. We
Yeah.
wouldn't have been able to do this or know how significant it was if it wasn't for that young lady using her voice. And she wasn't even an adult. So I'm pulling it all together. This helps us recognize that advocacy does not have a age range. It doesn't have a starting point until you start, right? We
Mm.
were talking a little bit earlier. Our advocacy as parents starts when we pee on that stick and we see two lines. When we
Mm.
decide which decision we want to make, how do we want to take care of this pregnancy? Do we want to move forward or not? How will this change our family's dynamic? What does it look like for where we live now? Is it still adequate for what we would need in order to make space for this new baby?
Mm.
Right? All of those decisions are forms of advocacy. And when you don't have the answer, you don't know where to go, you go to the people who raised you. You go to the people who have been in that situation, and their lived experience starts to become a part of your lived experience.
Mm.
So as advocates and as parents, we have the bird's eye view of how we can support people from those lenses, but we also have to be able to be active listeners as well, so we can understand what other people are experiencing, even though that might not relate to what we've gone through, right?
Yeah.
So our work is not a one-sided lesson. It's a two-way street, right? It's reciprocated effort. So in conclusion, because I'm just rambling at this point,
No.
in conclusion, the way that we create more opportunities to solve these problems is by looking at it as an integrated approach. I can't solve this for all Black people. You can't solve this for all white people. What we can do is open up conversations to see each other and
Mm.
realize that if we collectively work on this as a strategy, we are both primary stakeholders in each other's health outcomes.
Yes. And that when we uplift the people who are suffering or who are experiencing this,
Mhm.
everybody gets uplifted. It's not like the
Right.
the pie is big enough for everybody. I think that's one of the things that is a really unfortunate outlook that a lot of people have, is that when policy and resources are directed towards specifically people of color, then poor white people think, oh well, what about me? What about my struggles? What about this? And they don't
Right.
realize that you are benefiting from these policies. Like,
That's it.
we are all benefiting when somebody, I keep saying this quote, and I don't know who said this. It was in the Aftershock documentary when they were talking about it afterwards, but someone said when we make birth safer for Black women, it becomes safer for all women.
It
And
does.
I was like, that makes so much sense to me. And it's
Mhm.
so true with environmental health. It's true
Yes.
with education. It's true, like it echoes into so many different areas of these social determinants, where when we make it better for the people who are at the most risk, it becomes better for everyone. It's
Hmm.
not like a pie that when you take the resource away and give it to someone else, then someone else is missing. Like,
Right.
yeah.
Mhm.
And yeah, it's unfortunate that we've had that resource constrained mindset. Instead of seeing like the rising tide raises all ships, we have this mindset that like, oh well, if you're given resources, then that's resources that I'm not getting, and
Right.
it's just unfortunate. So I remember watching the movie Aaron Brockovich. Did you ever see that one with Julia Roberts?
Yeah.
Yeah, and
Yeah.
it was about like a small town. If I remember correctly, I think the cast is, if not all white, very much predominantly white. But it was a story about how I think it was PG&E was basically dumping toxins into the water,
Mhm.
and it was a movie in the 90s. And I came away from that movie thinking, wow, like I can't believe, like I always had the mindset of these things used to happen, but they don't anymore.
Mhm.
And even with racism growing up, it was like, oh, this was bad, but we're good now. And it wasn't
Mhm.
until my eyes were open to, oh, hold on, it's just good for me. Like it's just good
Right?
here.
Yes, yes.
Like,
Mhm.
oh, wait a second, this is not the reality. And then, I think also we have to have the humility to be like, well, maybe I was wrong, and maybe like the predetermination that I had about this was not correct.
Right.
But yeah, that it is pretty astounding, like how obvious it is that environmental issues impact health, and yet they are still so poor.
hmm
Yeah.
And honestly, environment is not just the air we breathe and the water we drink. It's what does my neighborhood look like?
Mm,
I remember years ago I took a health disparities class, and a question that the professor asked, it still blows my mind to this day. Do do you or have you ever lived on a street that had crooked sidewalks? And I was like, what kind of weird question is that? And I thought about it and I was like, I, my sidewalks actually weren't straight.
mm,
Like the neighborhood I grew up in, it wasn't. It was a very crooked sidewalk. And I was like, well, what does that have to do with health disparities? And they
yeah.
said, well, first, one of the first things the doctors will tell you when you go to the doctor, you're not feeling well, they'll be like, go outside and exercise, eat better food, this and the third, right? All right. If you walk outside and your sidewalks are not even, you have a risk of falling. You're not going to take your stroller out there.
Yeah.
All of these things can impact you from like just being able to walk around your block. Are you going to go into the street, potentially get hit by a car? Like
Yeah.
it changes people's dynamics with the way that they participate in their environment.
Yeah.
Also, safety. Do you feel safe in your environment? Are you able to walk through your neighborhood freely? Is it clean? I know when I was growing up, we used to look for like just a playground to play in. And
Yeah.
every playground we went to, the equipment was broken, the swings weren't always working. So it was like you have such a limited point of view of being able to interact with the environment. You usually don't,
Yeah.
right? So when we think of that and the way that people will choose to exercise or choose to do things that make you interact with the environment, everybody's choice is not equal, and it's also not equitable, right? So equal being, oh yeah, we both have parks, but equitable being you have a park that has all of this equipment. I have a park and I can only use the metal slide that burns my legs,
Yeah.
right? Like
Yes.
from an
So,
80s,
yeah.
right? So when we think about that, it shifts people's perception about how do I explain this to my medical provider, or how do I explain this to this person who's supposed to be a resource for me when they can't even fathom that this is how I live every day.
Mm,
And again, not making this about just poverty, because when I talk about these things and the differences, people automatically hear, well, you're poor or you should live in a better place. We live with what we have, like we live in communal ways and places. I lived with my family lived in these different neighborhoods, some really great, some not really great, but all of the exposure that I had, I still had to be just as vigilant as I was in the playground that had broken swings versus being in a playground that didn't have broken swings. I'm still a Black woman. I'm still being looked at as, should I be here? Is this actually safe for me? Is this the environment that is welcoming to me or not? Right. And now, as a parent, I have to have this same kind of conversation with my own children or
Mhm.
listen to their aspects of what they're facing and how people will create either exclusion or inclusion for them as well. So this environmental view of things are way bigger than what we just think about it from that lens of the air is clean, the water's
Yeah.
clean, so much more.
And those things, I think, really show the impact of like voting rights. And
Oh yeah.
when you cut a community in half and you take away the ability for a community to have a voice in even just city politics,
Hmm.
then them saying, "Hey, my swings are broken. My kid needs a place to play in the park." But if half of that is taken away from them,
Hmm.
then it has really huge impacts. And so all of this stuff, it's so interconnected.
Absolutely.
Yeah.
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 But I'm glad that we're having this conversation and we're opening up people's minds. They may have never heard the words Black maternal health in one sentence
Yeah.
before from a positive or negative lens. So I appreciate you, Allie, just for creating this space to talk about it and just recognizing that these are not things we need to have as just a one and done conversation.
Yeah.
This shouldn't just be during April. This is a every day, every month, every year conversation. So, thank you so much for just opening your doors to me and allowing me to share my voice on your podcast.
I appreciate it. I mean, it's something that I think is so important just to like raise the awareness. And I think it's important for um, us as white people not to see this as like a black issue, and not
Right.
to see this as like, oh, black, that's their month, that's their week. Like, no, this is
Hmm.
for us too. Because, like I said, that quote says, when we make birth safer for black women, it becomes safer for all women. Like, we're all invested in this.
Right.
And or we should be like
Yeah.
and and I think like there is something to the point of like I think that we have to have the humility to say this isn't my lived experience, but I can believe that it is someone else's lived experience. Like that I think is a really important takeaway for people listening to this that maybe don't like identify with a lot of what we're saying. Like you can believe that that is someone else's lived experience, or at least
Mhm.
have the curiosity to maybe, you know, open up to that.
Love them.
Because, yeah, that I think is something that's really like missing um, from a certain like group of people who probably won't listen to this podcast if I'm honest, but that's okay. Um,
Yeah, it's the right people will listen and the right people will make the change. So
yeah,
that's all you
100.
can do.
Yeah,
Mhm.
it's true. What individual advice or what advice would you have for like an individual? So talking to the black mom who's pregnant, who's maybe thinking about all these things, what advice would you give her?
Do not isolate yourself. Do not think that you're the only person that's experiencing this or that's going through it or has gone through it. Look for community. Shameless plug, Melinated Moms.
Yeah.
I started my
Yeah.
organization because I was a mom who felt like I was stuck in my isolation. I went through a divorce. It was just me and my two kids. And I'm like, how do people do this? How do single moms do this? How do moms who are married but still function as a single mom? How do they do this? So looking for the support that not just looks like you, but understands the different levels of experience that you're in or that you will experience. Community is everything. Community is always key. So I will tell her that find your community, find your tribe. I will also tell her to rest. That
Mm,
is, if I can't scream that loud enough, do not rest because you're exhausted. Rest because it is necessary. So
mm.
take the time that you need to like refill your battery and incorporate rest into your regular everyday routine. Not exhaustion, rest.
I
Yeah.
love that.
Mm.
I haven't finished the book, but the book Rest is Resistance really
Hmm.
spoke to me
Oh,
because I
yeah.
was like, I'm the type of person where I rest when I'm exhausted, or
Mhm.
I always saw rest as like rest wasn't safe. Like it wasn't a safe
Right.
time.
Hmm.
And that book gave me so much freedom to, oh, wait a second, this is actually an active choice. I am choosing
Right.
to rest. Yeah, I love that. I think that's super, super important and like very, very important for somebody in pregnancy, especially if you are more likely to experience hypertension, right? Like
Oh
that's
yeah.
huge. Yeah.
Yeah, and a lot of moms, regardless of race, if their household is a two-income household, um, we're two paychecks away from, really losing our stability. So there are more and more moms who aren't even able to take their full 6 to 8 weeks, let alone,
Mm,
an extended period of time to bond with their baby or, really um enjoy their motherhood because they have to get back to work. I remember I used to work for this amazing clinic, and we would have OB patients and then postpartum. And I kid you not, there was a young lady that came in. She gave birth, let's say it was Monday. She gave birth the previous Monday and was like, I need to be back on the schedule by next Monday. My girl, you just had a whole human. She's like, yeah, but I don't want to lose my apartment. You know, these are real people's concerns,
yeah.
So when we hear stuff like that, and then we hear about these, huge disproportionate rates of mortality and morbidity, because I mean, not that either one of them aren't important, but we know mortality is irreversible,
Yeah.
but we have 10 times more morbidity than we do mortality. So there are people like myself who are walking around with long-term effects from their pregnancies. I'm 160 months postpartum, and I still have I am, and I still
How do
have
you know that?
every time my baby's birthday comes, I'm like, all right, I had another 12. But they're 14,
Yeah.
and I'm like, all of these months later, all of these years later,
Yeah.
I'm still dealing with, the long-term remnants of my preeclampsia with them.
Mm,
And they 14, and years ago, the cure for preeclampsia was birth. Well, they've been here for 14, almost 15 years, but I still have medication. I still have to see a cardiologist. I still
mm,
have all of these extra levels of health and wellness that I have to adhere to because I need to be present for my kids, you
mm.
know?
Yeah.
So when I say choose rest, you know we'll find a way to make ends meet. And I'm definitely no one Santa Claus or anything else like that, but we need to have more conversations as a community, to help fill those gaps and help more moms find those resources so that they can adequately rest, be able to be recharged for themselves and to be present for the babies. And then when they are ready to actually go back to work, if that's what they choose to do, they're not doing it out of a space of scarcity or desperation.
Yeah.
They're doing it because this is now their next phase, right?
Yeah.
So I really, really want more Black moms, more moms of color, to really be able to do that without feel like you're sacrificing on one side or the other.
Yeah.
Hmm.
That is amazing advice. And yeah, I think finding that tribe, finding finding the people who can support you in that is it's literally like life saving. Like it's not just
Yeah.
like, oh, it would be nice to have these things. It's like, no, that your life matters and like
Mhm.
these things are important for your life and well-being.
Yeah.
What
And your
advice would you
baby.
and your baby, yeah, and your the health of your child and yeah. I know I've told people somewhat similar, advice when they are pregnant after loss, like,
Mhm.
or I just, finding that provider that you trust and really like speaking up for yourself, which I understand is something that like does come with privilege to be able to speak up for yourself. But it's like, if you don't feel this was the advice that I would give somebody when they were like pregnant after a loss and their baby wasn't moving or they weren't feeling like, you know, weren't feeling comfortable with the level of care they were giving. It's like, this is 9 months, but it's your baby's whole life. Like,
Yeah.
and it's worth it. Like, it's worth it for that level of like discomfort and for the difficulty of getting those things done. But it's worth it because it's your baby's life.
Right.
What advice would you give to just like the general listeners about or not advice, but like what are some ways that listeners can get involved maybe with advocacy, or if they want to learn more about this, what are some resources that you have for them?
Yeah, I mean, of course, come to
Yeah.
melanatedmoms.com. So really being able to explore our work and our impact. Our website is full of all kinds of resources. Our membership includes our blog, which has every other week we release a new blog topic of discussion, excuse me. And it's chock full of different resources that we use and we refer moms to. We also have a program called Perinatal Concierge Service, which is one-on-one perinatal support. We do care coordination. We have a nurse practitioner also that can help you review labs and
Mm.
ask or prepare questions for your medical provider visits, and really help you learn how to be an integrated partner in your care. Um, we also have our perinatal education classes. So Melinated Moms University, we have a catalog of different perinatal classes that are rooted in peer-reviewed case studies as well as journals, excuse me, medical journals that really help us to validate not just the topic of discussion, but the ways that we can create solutions from a holistic lens. And then the partnerships. All we have so many partnerships that really has helped to elevate who we are, but help us learn how do we make sure that we're not the say all be all do all. There's thousands of organizations that are doing great work. And if we can, pass the baton so that they can have
Mm.
more of a personalized experience, like, Planned Parenthood or March of Dimes, the National Partnership for the National Nurse Family Partnership, um, helping first time moms. Um, in New Jersey, we have a really great partnership with New Jersey Coalition to End Domestic Violence. So
Mm.
they have so many amazing resources, not just around how do you get out or how do you recognize domestic violence, but what does housing look like? What does
Mm.
economic development and stability look like? Excuse me, what does, creating jobs and opportunities for you to leave that situation, what does safety look like after going through domestic violence? They're another amazing resource. um, Also in New Jersey, shout out to Jersey. um, we were really instrumental, and have been longtime partners with the previous governor, and their initiative called Nurture New Jersey.
Mm.
um, I was one of the co-authors for the strategic plan. So if you have like an afternoon, you want to just read 97 pages of wonderful information, it's there.
Cool.
But a part of the strategic plan was to develop these different entry points of creating resources and support for families across the board. And one of the things New Jersey has done that set precedent is they've actually created their own separate governmental entity to actually address maternal health. It's called the New
Mm.
Jersey Maternal Infant Health Innovation Authority, and they oversee midwifery as a model, as opposed to it being under the Consumer Affairs, as well as doulas, community-based doulas, and the educational opportunities they have, and community health workers as well.
Oh.
So just those few really can open up so much of, like you were saying earlier, like the curiosity people
Mm.
may have around all of these issues. If we're thinking of Black maternal health specific, obviously April is Black Maternal Health Week, April 11th to the 17th. Every agency that touches a Black woman and her reproductive health does 1,000 events during that time. April in itself is Minority Health Month. So you'll see public health officials, you'll see legislation, you'll see academic institutions, all of these people, community based organizations, activists, they're doing so much work starting in the month of April. So just literally being on the lookout for those. Um, what else? The internet.
Yeah.
Honestly, like just being able to like grasp all these things that exist. We have the unique opportunity to be the generation that has access to more information than we ever have in
Yeah.
any other lifetime, right? So let's use it. Let's use the ability to think about how can I get involved and type that in as a Google search and actually find things. And, oh, my very favorite, the very last thing I will say, attend a conference.
Mm.
There are so many very amazing Black maternal health specific or reproductive health specific conferences. There's one coming up in Montreal. It's IAMAS, the International Association for Maternal something something. I forgot, but it's IAMAS. That's happening in Montreal in June. And then Black Mamas Matter Alliance. They every other year they host the Black Maternal Health Conference, and it's going to be happening this year in Atlanta, Georgia. Amazing. I can't talk more about it. It's just the most liberating place I think I've ever been, to not just meet other people who are just as passionate as I am, but to learn. They
Yeah.
have great workshops and brain trust and just all of these ways of understanding how do we create solutions with the information that we have, with the communities that we serve, and with our own lived experiences. So
Mm.
all of those things are the best resources I could offer.
Now I want to go. I'm like, how can I make this happen?
I'm telling
How can I
you,
get to
I love
Georgia?
it.
Yeah.
I love it. Yeah.
That's awesome. Thank you
Mhm.
so much. And then can you just share a little bit more about connecting our community for New Jersey? I know you shared a bit, but
Absolutely.
yeah, I want to hear more.
Yeah. So, we got the opportunity to build out a statewide coalition for New Jersey, but they wanted it to be a place to incorporate the BIPOC community. What a lot of people may not know is New Jersey is one of the top 5 states in the country for diversity.
Oh,
So yeah, I think number one is California, but New Jersey is quite diverse. So you
yeah.
have families from all over the world, different dialects, different cultural backgrounds, religious leaders, all of these things all live in New Jersey. And because it's so diverse in its makeup, they wanted to also make sure that everyone's voice is at the table when we talk
Mm.
about birth equity, and legislative process and understanding. So we had the opportunity to build this coalition. We're now in year 3, and we are learning what we were talking about earlier with the people to policy pipeline, but also how do we have more integrated conversation in insular communities that don't get the visibility, right? So what does a family who have parents of the same sex, what are issues that they may be experiencing? What are stillbirth parents experiencing? What are families from other immigrated communities? What kind of support do they need? Um, we had a partnership with an organization who had doulas who all spoke Arabic, and
Mm.
they saw not just women who were from the Middle East, but Muslim women and people from different cultural backgrounds who related to the way that they provided doula care. So that was
Mm.
a whole new resource that we didn't even know that people were searching for until
Yeah.
we found it, right? So like I love New Jersey, but just having the ability to see, this pocket of people need this pocket of people need this pocket of people need this. How, and then we were able to pull all these people together into this one beautiful coalition. It's been pretty awesome. It really
That's
has.
so cool. Yeah.
Yeah. So now we're seeing, we just finished doing focus groups to learn all of these intricate details about our community. And now we're working on what is the process for us to make sure all of these voices are included in legislation.
Mm.
And they also know how to use their power as constituents for their legislators who are representing them on that state and federal level. So it's really been amazing to, found this thing, but also be able to lead, but lead from the back.
Mm.
Like I think a lot of people don't look at leadership as the person that's watching everyone. A leader is not just the line leader. It's not just the person in the front with the arms crossed in the picture.
Yeah.
Um, a leader is someone who knows how to share the knowledge that they have, but also how to take in new strategies through people who are fighting this fight with you and who may have a completely different perspective that you didn't even consider before. And now they're looking at you as uh, their partner. How do we move this thing forward? So I'm very grateful and gracious to have that opportunity to be the executive director there. So it's pretty amazing.
That's really,
So
it sounds amazing. It sounds really cool.
yeah.
Yeah. Thank you.
Last year we got the opportunity to do like a reception. So we like actually formally introduced ourselves to the state. We had state officials and organizations that came, and we hosted a 3.5 day power building training. And like I said, we invited all of these different people who were part of different communities. We talked about what does power building and power sharing look like? How do we even define power within community and outside of community? And also, what are the building blocks? What are the things that are actually missing from the systems that we currently use? And how can we create a new blueprint? So that really helped us to solidify ourselves as representatives for the state. But
Mhm.
now it's opened us up for more opportunities to create smaller pockets, so that we're helping those insular places still feel safe and seen, but also having their voices in a broader lens be represented in that state coalition. So very grateful, very excited for more of what we're going to do this year, and then also like just figuring out what the sustainability look like, especially in this economy and this administration. So
Yeah. Yeah.
yeah. Mhm.
Yeah. It's sounds like there's a lot of work, but it's so validating and like it's good work. Like it's worth
Oh yeah.
doing. Yeah.
Oh yeah.
Yeah.
And it's so worth it.
That's so
You learn stuff from people every day.
yeah.
So it's great. I'm glad to be here.
Good. I'm so Jaye, thank you so much for joining me and for having this conversation. I really appreciate it, and I think it will be really helpful for people. Can you share where people can find you? I'll put it all in the show notes too, but if you just want to share, yeah.
Yeah, absolutely. So you can find me on our website, melinatedmoms.com. You can also find us on any social media platform at Melinated Moms, MELINATEDMOMS. And then we also have a podcast, Melinated Mommy Talks. So you can find us any place that you listen to podcasts as well. So
Awesome.
just glad to be here. Thank you so much for listening to my voice and adding
Yeah.
to the value that you're giving to the community too.
Thanks. Appreciate it. Well, everyone, thank you guys so much for joining us. You can find more on our Instagram at determinants.pod, and you can email me at determinantspod@gmail.com. I hope you all have a beautiful and healthy day.